Alright, today we're going to be discussing the anterior spinothalamic tract, and my name is Grace Ann.
I'm Mackenzie.
And I'm Taylor.
Alright, to begin, we're just going to look at a cross-section of the spinal cord, just to identify the tract that we're looking at. So it is going to be located into the anterior portion of the spinal tract, and Taylor's going to touch a little bit more on the pathway, where signals begin and where they go in order to go up to the brain, because it is an ascending sensory pathway.
Okay, so first the signal is going to be carried away by the nerve fibers and to the dorsal horn, down there where Grace Ann is pointing, and then the fibers are going to decussate in the anterior white portion, and so then after that it's going to travel up, like Grace Ann is doing, all the way to the thalamus, and then it's going to get to the thalamus, and then it's going to terminate at the somatic sensory cortex. And so just to talk a little bit more about that, the origin is going to be the nucleus proprius, where Grace Ann is pointing, and then it's going to terminate all the way at the ventral posterior nucleus of the thalamus.
And then depending on where the sensation is coming in from, it is going to respond and correspond with its respective location in the somatosensory cortex.
Okay, so now we're going to talk about the function. So its function is to carry sensory information to the cortex for crew touch. And so crew touch is like when something touches you and you don't know what it is or where it's touching you exactly, but you felt like a touch on your body. And it's also believed that this spinal tract can carry pain and temperature only if the lateral spinal tract is damaged, because the lateral spinothalamic tract is the primary source for pain and temperature.
Alright, so kind of tying it back to some clinical relevance. So this spinal tract can be affected in many different ways because of trauma, because of different conditions. I wanted to just touch on a couple of them. So looking kind of at spinal cord injuries, anything that can cause a severance of any of those nerves or those tracts is definitely going to affect the sensation of crude touch, and with the lateral spinothalamic tract as well. On lesions anywhere from the somatosensory cortex all the way down the tract, herniated disc, putting any type of compression on the anterior and the lateral spinothalamic tract is going to cause a loss of that sensation, most oftentimes paired with the loss of pain and temperature sensation and pressure as well. So some specific conditions I wanted to touch on. One that is very rare but is very interesting is the Brown-Séquard syndrome. So with this syndrome, you'll have paralysis on one side of the body, and then contralaterally you will have loss of sensation on the other side of the body due to it being a hemisection injury. And then also one that we've discussed in this class is the peripheral neuropathy, which is most commonly seen in diabetes patients. So that's where you're going to have loss of sensation, crude touch, whole 9 yards, in your extremities.
Okay, so now what we would do in this situation as OT, some of the roles would be risk management. We would assist with assistive devices and adaptation, and then some treatment would be sensory re-education, surgical depression of the spinal canal if there was compression, and then also neuroplasticity.
Okay, so we want to provide a sample case study just to show you how this would be in the real world. So an example is Lisa works the night shift at a diner to support herself and her 2 children. After closing one night, Lisa was attacked and stabbed from behind her on a walk home from work. She now has a hemi-lesion of her spinal cord, resulting in contralateral sensory loss. So what daily living activities would this impact Lisa being able to do? So some examples would be bathing, dressing, taking care of her 2 children, resting, shopping, and her job performance because of the crude touch that she's not able to do anymore. And then some possible therapeutic interventions would be sensory reintegration, risk aversion, and adaptive equipment such as like remembering to use an oven mitt when she touches something warm, or remembering to wear pants if she's going on a walk outside because she might not be able to feel if something scratches her.
Alright, so it's now time to test your knowledge. So we're looking at a patient that's having loss of crude touch sensations below L4 on the left side. Where would the lesion potentially be located? So we have options A, B, and C. We will now give you time on your note cards to pick which choice you think is correct. Time is up. The correct answer would be C, because remember, with the spinothalamic tract, you are going to decussate. So whatever region of the body, say left or right, the sensation is going to travel up to the contralateral side of the brain. So C is the correct option. Thank you so much for your time.
Thank you.